I mean, I know we were supposed to be talking about health, but, I guess you can kind of attribute that to health because, a gun in the wrong hand can lead to a lot of death. So we're just going to leave it at that. But,
We can pop back over to the vaccine thing and talk about, I think it's Dr. Todd from Viable TV on YouTube. He did a video recently about Bill SB 163 and how I think he said they went to the courthouse or something on the weekend to try and get this bill passed behind everyone's back, which is really weird because I didn't even know that you could do any of this kind of stuff on the weekend. I just considered places like that to be closed. And so he wanted people to be aware of what's going on and how they're trying to slide these little different bills in while people are not looking. Because, of course, anytime there's something major going on in your country, like how we have protests right now, you should always be looking under the surface because whatever's going on the surface is always, just cover for something much more bigger than that.
Well, here's my theory on it. I'm glad that you even said that, even bringing up the protest part. Remember, we had an earlier conversation about the baby boomers and how they are some of the last generations to get what is called a pension. And for people out there that don't know, a pension is different from a 401k. A 401k can fluctuate. If the company's doing great, then you doing great. But if it's doing bad, your 401k sucks, okay? A pension is pretty much guaranteed. Like, they have to give you either in a lump sum or pay you over a course of time. Think about the baby boomers. They are the ones who are pretty much some of the last recipients of what is called a pension. There may be some other ones out there that are in the, close, a little outside that age, but that's the age group right there. And when you think about the numbers of the coronavirus and who it's affecting and who's dying, we're talking about the older people. Another part of that, where I feel like there's an extermination, you have people who are, their health is not up to par, like people with kidney issues or upper respiratory issues, people that would be considered weak who are collecting, disability checks and everything. This is a way to kind of get rid of them. I mean, this is a theory, so I don't want nobody saying that, this is fact, but it's just something I looked at because I'm looking at the people that it's affecting and also the people who they want to rush in and give these vaccines to. Again, you got to see the benefits of how it benefits the people who are in, staying to profit, not only from the vaccine, but not having to pay out these pensions and these other things and how it works out. It's just a theory out there that I look at, when thinking about it. And even with the protest, I mean, I was even tying that with that. I mean, we're talking about the protests currently, but let's talk about the last 20 years. We're not the only country that's had uprising. Syria had an uprising. Egypt had an uprising. Sudan had an uprising. I mean, there's people that are not ignorant anymore to propaganda being fed to them, and when they feel they're being mistreated, they're standing up saying something. Now, this is another way of getting rid of some of those undesirables, that are out there. I was telling people, when they were protesting, it may be, something to be aware of, being careful when they're doing this tear gas and spraying this mess out here, on the people. Like, they tear gassed a whole bunch of people in Washington for the president. I mean, it amazed me, you know what I'm saying? And all of a sudden, if people hadn't noticed in the news here lately, the uptick has rose, and a lot of people are going to blame that on the protests, of course, and people's ignorance, but they've man-made diseases before. They've experimented with diseases before. And who's to say that they're not finding ways to give this stuff out, when there's a mass of people collected together?